What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how much of the times do we spend holding the actual patient during the x-ray exam. So to give you context, I'm a night shift tech. I've been doing it for about 4 years. And in school, we've always been taught that you shouldn't hold the patient, that you should let maybe the family members, maybe the nurses, maybe anyone else besides you to hold the patient. But the reality of the situation is, most of the time, if it's a baby, sometimes the parents will help you hold, but sometimes the mother is the one who kind of always ends up in the emergency room or at the doctor's appointments. And if they're currently pregnant, well, you can't use them. Even if they wear lead, you still feel bad, so you have to end up holding them. Certain nurses will hold only if it's their patient, or depending on what floor you're on, they'll hold. Other times nurses don't want to do it. I know for sure in the emergency room and the trauma room, they'll hold it. Most of the time on certain floors they won't. They're more afraid to hold because of the radiation. I know some of the older nurses don't really mind. For us techs, most of the times I'll hold if I see the patient and I'm like, okay, this is worth me doing this. Because sometimes patients come in and they don't care about themselves. They'll be cussing, they'll be yelling, they'll be treating everyone like very bad, very mean. And I'm like, I'm not gonna hold this. Like, why am I doing this if he don't care? He's refusing treatment. So there's a certain level of where you have to think to yourself, is this worth me getting the dose? Is this worth helping the patient? Does the patient care about their own treatment? Certain patients we have that are more special needs, to the point where they're bedbound and don't do nothing, and then maybe their body's contracted in a certain way. Well, there's really nothing you can do. Even if you hold it and you try to position, their leg is contracted that way, it's not going to move. So there's really no point of holding. Maybe you adjust the angle, maybe you kind of tilt the patient a little bit with pillows, but there's really no change going to happen. You're just getting x-ray dose for no reason. Certain exams, like the cross table hip, do need to be worn with lead. Especially sometimes you end up in the emergency room kind of by yourself doing it. Most of the time we don't, but occasionally it gets busy and you will have to do both hold and press the button to get the job done. So there's those times. Other times when you're by yourself, and let's say you're in the trauma room and the patient, you have to x-ray their hand, but the patient really can't hold it because maybe they're intubated, maybe whatever they have going on, they're not in the best condition. So you too have to hold and position and shoot, and it's kind of back and forth running from the machine and positioning the patient. I try not to hold that much, just due out of the amount of I work so much at the hospital. I work a bunch of overtime, so I know if I hold a lot of the time, I would end up with a lot of dose. So majority of the times I'm the one running the portable machine. And at my job, since everyone knows I kind of work way more than almost triple the amount of everyone else, most of the time they end up holding. Certain times I end up holding just because it's more convenient, or maybe because of the patient's body habitus, and it takes a certain amount of strength to actually be able to turn the patient, or that there's certain situations where I may end up holding it, but majority of the times if it's an older tech, they'll kind of end up doing it. It's not a big deal even if you do or you don't. I will say you have to be careful to a certain degree of how much you do, because if you do it too much, eventually you'll end up, your low dosimeter, when they go turn it in, it'll notify, you know, the registry and the board with hey, this tick's getting too much dose. You'll kind of get a warning, and then you kind of could get suspension of a time just for the radiation situation. I know if you work in the main radiology and you do the fluoro exams, you do acquire more radiation over there, even though you're behind a lead apron / the RPA or the radiologist. You still get like scattered or splash radiation from that, so you have to be careful on that too. Let's see what other times. Sometimes 2-view chests. Certain doctors will order it to get the patient's like pacemaker or like monitor like checked. You'll have to like make sure that it's like they're stable. I know sometimes certain patients aren't as stable because like certain arms that get done, like their pacemaker, it's like a little chicken wing and they can't literally lift it up. So you're kind of left with you kind of slightly elevate one arm and the other one kind of gets pulled back, and that kind of gives you the best images. Certain patients post-procedure aren't able to stand or like be able to get the best images. You could probably, for 2-view chest, do the AP portable and then do the lateral in a wheelchair. That would probably be the most safest way to do a 2-view with someone who can't stand. Yes, it's more work, but that would probably be your safest bet. And you may still have to hold, because depending on how they're positioned or how hunched they are, you may still have to hold to kind of like lift them forward from the wheelchair and kind of be able to get all the anatomy on the x-ray. So there's that going on. But overall, even though your school says don't hold, majority of the times there's a chance that you will have to hold, and you'll have to, you know, kind of do it, because depending on what's going on, sometimes nurses can't help you, parents can't help you, and it's up to you to ultimately let up and do it. Always let up. I know some of the veteran techs who've been doing it for a really long time don't let up, and they just kind of do it because they're over it, but I would recommend that. Just always let up, even if it's a small, tiny dose. Always wear your protection to keep you safe. I mean, you'll still get a small amount of dose, but it's better than getting the full dose, because it just adds up over time. You may not feel it now, especially if you're planning to do this field for a long time. All of those doses end up counting in the long run and could affect you. So if you're still here, I appreciate you. I post videos almost every single day on different aspects of this beautiful field of radiology. Majority of the times there's a lot of nursing videos. My lady's a nurse. There's a lot of videos on a bunch of different fields, and there's none on x-rays. So when I was a student, I remember looking on the internet, on the YouTubes for certain stuff, and I would look at very like niche questions, and sometimes I would find it, but it'd be videos from like 2010, 11, super outdated. And I was thinking to myself, why not educate the people who are new to the field, curious about the field, or are currently in the field and want to know about certain stuff that maybe they don't teach you in school. So I am here to educate you in that aspect. Literally, as a student, I would always have questions that sometimes I wouldn't want to ask my teachers, or I'd be too nervous to ask like some of my like techs at work, at the facility, because I think they would make fun of me, and I would go on the internet and I couldn't find like no single aspect of it, or it would be too vague. So I'm here covering every like niche, tiny little subject, just so if you're curious about it, there is literally like, maybe I can't give you exact details because every hospital or every location may do their stuff differently, but at least you have a general understanding of what you can expect, or maybe what the protocols or something like that can do. Because in our field, yes, majority of the exams are the same, like a chest x-ray, 1 view and 2 view will probably always be the same. Maybe they do the AP instead of the PA, or maybe they'll do their laterals this way. But for the majority of the aspects, all the exams are kind of the same. They may tweak between like obliques or certain stuff depending if you work at ortho or if it's pediatrics. They may have different protocols, but at the end of the day, it is kind of the same thing. So it's been your boy Miguel. We'll see you on the next one.